Hi guys, welcome to our gross anatomy abdomen lecture. Today we're going to talk about the suprarenal gland. Suprarenal gland. So your suprarenal gland, these are glands that are found on the superior uh, border of your kidney, right? You can actually see they are bilateral. It's above the right kidney and above the left kidney, right? This suprarenal gland, take note, they are found within the same renal fascia with the kidney. Remember the renal fascia of the kidney, which we said is a continuation of the transversus abdominis. Yes, so they are found within the same renal fascia with the kidney. They are also surrounded by the perirenal fate, right? But they don't directly sit on the kidney, right? So there's a septa that actually separates them from directly sitting on the kidney, though they are in the same renal fascia. You understand? So these suprarenal gland, they are divided into a cortex and into a medulla, as we're gonna see. The cortex is involved in production of hormones, mineral cortical hormones. These are hormones that are involved in water and mineral regulation in the body. They're also involved in the secretion of glucocorticoid hormones that take part in the metabolism of carbohydrates, as well as fat, as well as some hormones, some sex hormones that are very essential in the prepubertal development of your gonads, right? Then the medulla of the suprarenal gland is actually a post-ganglionic sympathetic um, sympathetic neuron, right? It embryologically it is derived from the neural crest cells, and you're going to have the its main function is to secrete catecholamines, that is norepinephrine and epinephrine, but it secretes more of norepinephrine than epinephrine. You're going to look at it as we're going to do the 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 physiology. You understand? But as for today, we want to take a look at the gross anatomy of this suprarenal glands. Right. First key that you have to take note is this: the right suprarenal gland is triangular shaped or a pyramidal shaped. Right. So the right suprarenal gland is pyramidal in shape, right? And the left renal gland is crescent shaped. So that's how you differentiate. And the left renal gland, it actually sort of like extend towards the hilum, right? Good. What is the blood supply to your renal glands, suprarenal glands, right? So the blood supply is a bit confusing um, because it is supplied by three arteries coming from different origins, right? So you are going to have um, what you call an inferior phrenic artery. Remember the inferior phrenic artery when we did the abdominal esophagus, when we say that the abdominal esophagus is supplied by one, by the gastric, by the esophageal branches coming from the left gastric artery. You remember, right? And we said by when we said that with the left inferior phrenic artery. So this is the inferior phrenic artery, right? It's going to supply part of your diaphragm as well as give a branch to your abdominal esophagus, and then it's going to give what we call a superior um, suprarenal artery. So this is your suprarenal artery actually coming from there, right? So this is your inferior phrenic artery. So it will give your superior suprarenal artery. Done. And then another second supply, blood supply to your suprarenal gland is going to come from a branch coming directly from the abdominal aorta. That is your mid suprarenal arteries. You can actually see, right? And it is given above the level of the commencing of the renal arteries, right? So this is gonna be your mid suprarenal artery. It will come directly. Then the last one is gonna be your inferior suprarenal artery, which is gonna be a branch of your renal arteries. So let's take a quick look. Superior suprarenal artery comes from the inferior phrenic arteries. The mid suprarenal artery comes directly from your abdominal aorta. Then, lastly, the inferior suprarenal artery comes from the renal artery. You understand? And take note of this, it's very unique, and they usually ask it in your MCQs. Though you have three sources of blood supply, you only have a single um, venous drainage, right? You have a single vein, which is which is called your suprarenal vein. But take note of this: the left suprarenal vein that drains into the left renal vein, while the right suprarenal vein drains directly into your inferior vena cava. You understand? Good. So that is your blood supply. That's your venous drainage of your suprarenal gland. So thank you so much. Take care.